Mass General, we're coming with a 64, that's 64-year-old male completing a 9 out of 10 chest pain, starting 2 hours ago with a history of a stent. BP of 125/77, heart rate of 91, setting in 100% on nasal cannula.
Northeastern is known for experiential education. That experiential education starts here, well before our students are going on co-op now. You need to take knowledge out of a classroom setting and understand how you apply and practice that before you try that on actual human beings.
What do you think, 7?
Sure.
Going through that experience and learning through the simulations and through VR, you don't realize how helpful it's going to be in real life until you're actually in those real life situations that I'm also experiencing in real life on co-op.
You can see the patient moving, you can see the ambulance, and you can actually put on oxygen on the patient, feel the pulse. You feel very prepared when you get out into the real world and have to do these tasks on real patients.
What we do here is really high fidelity simulation that is among the most professional I've seen in the country, with the professional actors and the mannequins. Most of our cases take more than a year to script, practice, pilot, then launch before they actually are seen by a student in the setting of a course.
I didn't realize how real life it is, all the simulations they give you here at Bouvé. We teach you what it's like to work alongside people. We teach you what it's like to talk to patients, which is something that's really not taught in college. It lets you truly understand what it's like to run a call from beginning to end.
If you don't know if healthcare is right for you, you will figure it out here. It gives you a much better look at healthcare as a whole rather than just the track that you've set yourself on.
When we're preparing and we're thinking about what our students need to understand and appreciate before they go see patients, that they need to be the new EMT, the new nurse, the new PA, who's part of a team of other nurses, PAs, pharmacists, physical therapists, who work together for a holistic view of patient care. And we all have those different areas of expertise to really support that entirety of what the patient's needs are going to be.
These scenarios are very emotionally intense, but you're able to be better prepared for when those high-stress scenarios evidently happen in your professional career. It really kind of takes that power of learning to the next level.